Hi, let's have a chat about PRP. This is platelet-rich plasma, and it's an area of aesthetic medicine that has been around for a number of decades. It's called regenerative medicine, and that means that we're using your body's own healing capacity to help produce collagen. We all know the statistics. Our collagen is declining over many years, and it drops off a cliff around menopause. There are often two really big aging points. One is at around 45 years of age, which is probably perimenopause, and then the other is 60, which would be postmenopause generally. Platelet-rich plasma is where we take a sample of blood from your elbow, about 2 teaspoons full, and we spin it in our centrifuge to extract out the red blood cells and white cells. And what we're after is the plasma, the yellow-coloured or straw-coloured liquid. In that, we have billions and billions of growth factors and blood vessels, stimulating factors and repair cells. And we want to get those back into the skin to help nourish it and help repair it. There are a couple of ways you can get it back in the skin. One is you can put it on the skin and then work it into the skin with a SkinPen microneedling device, and I love doing this. The second is, on top of that or separately, you can actually do tiny injections, either with a tiny needle around areas of concern like the eye area or the mouth area, where we're getting all those kind of repetitive movements and the skin is getting kind of crepey and thin there. And we can also use a cannula to fan it out over a bigger area. You can do PRP on the face, neck, décolletage. You can do it on the hands, and you can combine it with the SkinPen microneedling in those areas as well. It's been used in orthopedic medicine for many years, and it's often, you'll hear relatives who've had it injected into tendons or into joints to help heal. And it's also used in veterinary medicine for muscle and soft tissue injuries. So it has a good pedigree. It's been really well tested. It's got hundreds of clinical studies. Some people use it for hair regrowth. We focus on the skin repair, and do get in touch if you have any questions. You will have a little bit of downtime, so you'd expect that day that your skin is going to be red. It'll be a little bit tender. You could get some tiny bruise marks from the cannula or needlework. So you would really need 24 hours where you're either working from home or you're off work. You just can't use any skincare products that day. Here's our sample of blood, 11 mils, and we're going to centrifuge that now to spin it and extract all the growth factors for our PRP treatment. We've spun our blood sample for 10 minutes, and now we've extracted the plasma. We've got the red blood cells and white blood cells here. This is the gel from the tube, and the platelet-rich plasma is all this rich goodness here that we're going to use with our SkinPen microneedling treatment. We can work the PRP liquid into the skin using the SkinPen microneedling device. After that, we can also use the PRP liquid by cannula or needle injection into areas of particular concern anywhere in the skin.